go into the system and navigate through that. Sound good?
That sounds great. Well, yep, that sounds good to me. Good afternoon, everyone. This is Katie Ott from M3 Insurance. We are the advisor for Trachte. And really appreciate everybody jumping on the line to take the time to prepare for the one-on-one meetings that are taking place next week. We have Bonnie and Jamie on the line as well. They have been absolutely fantastic in supporting these initiatives, in getting the message out, getting the scheduling set up. So I'm really excited about what we're going to be able to accomplish in terms of educating employees and getting them signed up for the new benefits. I don't want to steal any of Jamie's thunder, but I think it's important to understand the context here that there is a pretty rich medical plan that is going to be going away next year, and the intent behind offering the new worksite plans is to help ease that migration and help employees start to bridge that gap. So I'll turn it over to Jamie, if that's all right with you, Jamie, and let you give a little bit more color in terms of what's happening with the plans and what messages employees have been hearing to this point.
Great, thanks, Katie. Yeah, just as Katie said, so this is, first of all, the first time that we're going paperless and using an electronic system, so this will be all new to the employees. In fact, there's some questions around, do I or don't I have to go to these meetings, and what are these about? So it's really just going to be, selling people on why they should use the system, not only to get enrolled next week in next week's sessions, but to encourage them that for any questions they may have in the future of, hey, I haven't been to the doctor for a while, I don't even remember what my deductible is on my health insurance plan. And so guiding them that, hey, here, let me show you where you can look that up yourself. Bonnie and I will, of course, always be a backup for them, but we're really trying to make this a self-service tool to some extent for them to be able to utilize on their own. The other big one is with the Unum plans. This is a 1 week window where the employees have the opportunity for the first time. These are brand new policies for us. So during this 1 week window next week is the only time that they will be able to enroll without being subject to medical underwriting. So really driving that home for employees, because you might hear, can I think about it a little bit more and I'll get back to you. Once we get past April 1st, they would be subject to any medical questions because these are not going to be new enrollees. These would be existing employees who have already, and this is their eligibility period up until April 1st. So that is going to be important to drive home. And then, as Katie said, with the health insurance plan, the copay is going away next year, and we do have several employees on that plan still, and so they may not have to switch this year, but BenAware has that nice tool that they can compare the three plans, and based on their individual family situation and health conditions that they may have, the tool can help guide them as to which plan they should elect for this upcoming year, but also reminding them if they choose to stay on that copay plan, okay, next year this goes away, kind of thing. Does that make sense?
And then we're currently only going to have the BenAware software as a view only for the employees.
I was just about to elaborate on that. So yeah, Dave, Vern, if you do mention that to the employees, I've got it currently set up where during the open enrollment, it's not like they can leave you and then log in. I actually don't have the self-service set up until the week after that. Actually after Georgia gets enrolled as well, because technically the system would allow them to make changes, and I don't think that's what we want. So, but after open enrollment is over for both locations, they will be available to log in, and I will certainly get that communication piece out to you, Bonnie and Jamie, here soon, so you'll have that ready to shoot out to them as to how they'll log in.
Thank you.
Mhm.
Okay, great. So I'm just going to walk through this benefits guide, this PowerPoint presentation. It's a PDF, actually. And I'm no expert at these core benefits, so Katie and Teresa, Jamie and Bonnie, please jump in, stop me, take over, do whatever you want as I kind of walk through this.
Sounds good.
Okay, so for and effective, for
Scott, are you there?
We lose Scott.
oh, I was
Yeah,
muted.
There we go.
Sorry about that. Okay, so effective April 1st, let's just talk about Wisconsin right now. So effective April 1st, this is the time when the employees can make their changes. Outside of that, of course, they need to have a qualified life event. So they can switch their plans, enroll in medical, dental, vision, add dependents, and then re-enroll in flexible spending. That's something they have to do every year. And then also, we have included in the system this year the 401k contributions. We'll get to that later, but that's something that needs to be done as well. Oops. So all current carriers staying in place, except for Unum, which is new. So that's a good thing. Trachte continues to work with M3 as their insurance broker to negotiate with providers to minimize rate increases. So it looks like a total 7% increase, but no plan changes, no carrier changes. 3 different HMO medical plans. You have a $500 deductible for employee, $1,000 for family, $1,000 deductible, and then a copay plan. There's another grid in here that has all the details.
Can I ask a clarifying
question? This is the last year.
Sorry.
Yes.
Sorry.
Sure.
Is the purpose of going through this PDF to educate the counselors? Because this will not be covered with the employees, right? Okay.
No, they won't have that kind of time to go through it, but I'm giving the enrollers all the information that I have, and they'll basically take some high-level information from this, and that's what they'll communicate.
Got it. Thank you.
Sure. 0 increase for dental, vision, life, and disability. No plan changes. Domestic partners can be added to all the plans except the FSA accounts, medical and dependent FSA. All employees are going to have one-on-one meetings, and then sign-ups have kind of already been done. New supplemental plans, and there's more detail to these later. Accident, critical illness, and hospital indemnity, all with Unum. Okay, courts. There's some kind of definitions here, difference between a copay, deductible, and co-insurance, primary versus specialist, urgent care versus ER. We know that the benefit to an employee by going to an urgent care versus emergency room, unless they have to, of course, is it's going to be less out of pocket for them. Preventive office visits covered at 100%. No deductible, no co-insurance, no copay. This is interesting. Optometrists and chiropractors are considered primary care doctors, not specialists. That's something special. Eye exams are covered under your health insurance. Now I have a question about this. So that's not like a, is that for a medical condition eye exam?
This is Katie. I believe an annual exam is covered, but no materials. Do I have that right?
I believe that's right.
Yeah.
Okay, that's good to know. An annual eye exam is included. E-visits and video visits are a convenient way to save time and keep costs down. That's also, there's more information later in here. Choice 90 program in my chart, there's a ton of information in here. So the first, I'd say, 20 slides or something is probably like the core information, and there's a lot of other ancillary information in here as well. And I believe that, Katie, did you guys conduct, or did Bonnie and Jamie conduct group meetings earlier using the same PowerPoint?
Yeah, so this PowerPoint was used to conduct the group meeting. So this was reviewed by the courts representative, and so this should be all repeat information for the employees. Again, not that you're going to go through this, but we thought that since it was used to educate employees, it might be useful for you, our benefit counselors. The HMO 2-1 plan is $1,000 deductible for single, $2,000 for family with 20% coinsurance, and a max out of pocket of $2,000 for single, $4,000 for family. $100 copay for emergency room, and then you can see the prescription drug schedule there at the bottom. So again, not something that I think you necessarily need to get real granular on, but understanding what this plan structure looks like is important, and to give context when you're meeting with the employees.
Gotcha. One question on the prescriptions, $5 RX outcomes, what does that mean?
I believe that's for...
that off the top of my head.
That is if you have any chronic conditions like high blood pressure, high cholesterol, rather than paying the $10 generic copays, it's for those routine prescriptions that you can get like a 3-month supply and pay a $5 copay each month.
Okay. So otherwise, $10 is generic, $35 is formulary brand name, $60 is non-formulary brand name, and $200 is specialty. All right, next plan, HMO 1-1, $500 deductible, $1,000 for the family, 20% coinsurance, $1,000 out of pocket max, $100 copay for the ER, and same thing on prescriptions. Third plan is a copay plan.
And this is the one that's going away next year.
Yes, yes. So no deductible, no coinsurance, out-of-pocket maximum is higher, $30 primary care, $50 specialist, $50 urgent care, $100 emergency room, and then inpatient hospital $250, 100% coverage for delivery, outpatient services. Yes, this is a very rich plan. And then same thing on the prescriptions there. Yeah. Okay. So on this plan, employees, because of the group meetings, do the employees know this is not going to be around next year?
Yes.
Okay. Should we communicate this to employees that do enroll in this program that, well, I'm enrolling you for, the next plan year, but the following year it won't be around? Should we do that?
I would say yes. Jamie and Bonnie, would you agree?
Yes.
Okay. Okay, 24/7 on demand. This is a video visit, like a virtual visit, kind of like telemedicine. I believe there's no copay or any cost to this. Is that right?
There is a cost to it, and it's also important to know that this only applies to the Wisconsin group, not to the Georgia group.
Okay. Okay, let me make a note of that. Wisconsin only.
And again, since this won't be in the system, it's not something that I expect to come up a whole lot.
Right. Exactly. This is for reference, guys, just so you know, though. Oh, there it is, $49. Okay.
There you go.
So like any telemedicine type of visit, it's for those normal kind of things that can be diagnosed over the phone or in a video chat, basic stuff. My chart, this is a tool that Courts has where you can log in and you have your own specific login, so you can look up your records, EOBs, etc. Print out ID cards. Digital wellness program. Didn't go into too much on this.
Yeah, this is the wellness program where they can earn points. That's pretty much what you need to know. They can earn points. They get an Amazon gift card. I would be more focused on the wellness benefit that's attached to the worksite plans.
You got it.
But I think it's worth noting if they get that, if they're engaging in those wellness behaviors, not only are they incented by the health screening wellness benefits on the insurance products, on the worksite products, but they also will earn points through course.
Got it. Okay, dental plan. Let's see, Delta Dental, PPO. Diagnostic and preventive covered at 100%. There's actually better information on a kind of a grid on the next page here. 71% of enrolled members used services in 2018. Interesting. Dental plan includes a vision care discount program as well. Let me make this bigger here. Okay, so we have the PPO and Premier plans. Both have a $1,000 annual maximum. You can see the deductible that does not apply to preventive services, but it does apply to major, basic and major services. And you can see here the breakdown. So basically the PPO plan has higher percentage of coverages line by line. Of course, all the preventive services are covered at 100% on both plans. 50% co-insurance.
One plan. These are actually two networks.
Oh, is that what it is? Okay.
Do I have that right, Jamie? I'm 95% certain on that.
Yeah, so we just have the one dental plan, and the provider network that is in network is the Delta Dental PPO.
Okay.
If they see a Delta Dental Premier dentist, then they follow the out-of-network guidelines. And if it's a non-Delta Dental dentist at all, they still have coverage, but they also follow the out-of-network guidelines, which is the same column as the Premier.
Gotcha.
Also important to know for the dental is that about 92% of the members, and by members it includes employees and their family members, 92% of the employees are using a Delta Dental dentist for their services, which means we have 8% that are not. And we've narrowed that down, that the bulk of that happens at the Georgia location. So would like to have some extra conversation, which we will also share during our presentation, but extra conversation around if you see a dentist that's not part of Delta Dental, you're probably paying higher costs because there's not negotiated contracts with those dentists. And so not only is the insurance carrier paying more for the claims, but any out-of-pocket expenses, the employees would be paying more as well. And that will also can also contribute to driving future premium increases.
Right. Okay. And then orthodontia for children up to 19, 50% coverage, $1,000 lifetime max. Okay, vision plan, Meredith Vision, using the VSP network. There we go. In network and out of network. Eye exam copays, material copays. Eye exam is covered in full in network, and you can see that lenses are covered in full as well. Frame is $130 allowance, and then the frequency is once a year on the eye exam, once a year on the lenses, and once every 2 years on the frames. Basic life insurance, company paid $50,000 of life insurance to all eligible employees. They have the option of buying up with optional term life and AD&D. for employee, spouse, and dependents. Trachte provides long-term disability to all employees at no cost, employer paid, and then they contribute 50% of the premium for short-term disability. New benefits: accident, critical illness, hospital indemnity. Jamie and Bonnie, have the brochures been delivered? Have you received the brochures from Unum?
Yes.
Excellent. Now, in the training invite, guys, I included the actual proposals, but this is very good. I'd say high level, but it's pretty detailed also, information. So the accident plan, you know, this works on a fee schedule. It's actually included here as well. $50 wellness benefit included, family coverage, no health questions, guarantee issue, off the job coverage. And there's the actual fee schedule as well. Accidental death on here is 50,000. I think it's on the second page. But you know how it works. Broken bones, dislocations, eye injuries, burns, etc. It pays on a fee schedule. Many times it can actually outweigh the out-of-pocket costs to the employee. So that's a nice benefit. 50,000 AD&D for the employee. Critical illness, $10,000 or $20,000, guarantee issue, pays a lump sum benefit, coverage is portable, just like the accident. Dependent children are automatically covered at 50% of the employee at no additional cost. There is a $50 wellness benefit in the critical illness as well. And you can see the list of covered conditions. I like to use the actual proposals. Well, you'll have brochures on site too. Oops. Then there's a second, there's a reoccurrence benefit also if separated by more than 180 days. Hospital indemnity has a $500 benefit for admission, and then $100 per day hospital confinement, and $200 per day for intensive care. The hospital indemnity plan also has a $50 wellness benefit included.
So one screening can potentially mean $150 worth of wellness benefit for employees.
Yes.
And for any insured, really. Now, most children are not going to get these screenings, right? But for adult covered individuals, one screening, if they're enrolled in all three plans, is going to get them $150 once per year. And I like to encourage employees to think about that in the context of what their spend is on these plans, should they choose them.
Scott, can we go back to the critical illness?
Yeah, sure.
So dependent children and spouses get 50% of the benefit. There is no additional cost for children, but there is additional cost for spouses.
Yes, that's right.
Okay. I wasn't sure if I heard you correctly.
Yeah, it's just for children.
Thank you.
Sure. Flexible spending accounts, they have a medical flexible spending and a dependent care FSA. And the maximums are in the system. You just put in the per pay period amount they want to contribute or the annual amount. It is very important that if they're currently contributing to the FSA and they want to keep that contribution going, that they meet with you and that you get that in the system. That will not roll over.
While we're on the topic of pre-tax benefits, I want to point out that the Unum plans are post-tax deductions. So that therefore guarantees their benefits are not going to be taxable under those plans.
Okay. Now, on the FSA, is there a debit card that they receive, or any way how they file claims? Or
the company does provide many debit cards for them to use, yes. Okay. They will receive those approximately 2 weeks after enrollment. If they are a new participant to the Flex plan, and that applies to the healthcare FSA only. If they are currently in the Flex plan and they are re-enrolling, they will not receive a new Benny card. That Benny card will simply be reloaded with whatever their new election amount is.
Okay.
Can we confirm that, this is Olina, if the FSA, if they change their contributions, that's going to start April 1st? Or does it go by calendar year?
Everything is April 1st.
Great, thank you.
You're welcome.
Okay. All the rates are here, but of course they're in the system specific to the employee, so you don't really need to reference this. Expense comparison, annual expense comparison. Nice reference for the employee. And then wellness, why wellness. And like I said, there's a lot of other extra information. You're not really going to be going over any of this, but it's there for employees' reference. All right. So let's take a look at the schedule real quick. Dave and Vern are the enrollers going to Oregon, Wisconsin. And I'm going to edit this a little bit because I believe Deanna was mentioning this the other day, that when we had our call the other day, that you would like them to arrive at 6:20, I think was the time.
For Monday, because they're going to meet with Jamie. They're going to meet with us before they start on Monday.
Okay, great.
So the enrollment sessions with the other employees start at 7 o'clock. But we were hoping they could be here by 6:20 so that Bonnie could sit with one at 6:30, I could sit with the other at 6:30, so that we ourselves have a sense of, we've been through this, we know how it works, because we're certain that we'll probably get some questions from employees.
Sure. Okay. And then I put addresses on tab 2 here, but let's talk about logistics for a second, because on our call the other day, you also mentioned that this is like the main address, but you're physically located at a different address.
Correct. We're at 490 North Burr Oak, which is right next door.
Right next door. Okay. All right. And I'll provide your contact information to Dave and Vern as well. And then for the Georgia location, I have 8 to 4:30. And then that is the 2nd, 3rd, and 4th.
Yeah, Scott, if we can go back to the Oregon one. So you said one of the counselors is Dave?
Yes.
Yes, and what's the name of the other one?
Vern.
So the 490 North Burr Oak is where one of them will be at for the week.
Okay.
There's a second address that in Oregon that the second enroller will be at.
For just Monday, Tuesday,
okay.
Wednesday.
For just Monday, Tuesday, Wednesday.
Yes, that's right. So, but they're still on Monday coming to the 490, and then you'll put them wherever they're going to be enrolling, right?
Actually, that was the plan, but I will meet the other one at the second location, because I'm going to go from one meeting, from this meeting into another meeting, and that'll get them going, and we won't have that drive time in between the buildings.
Okay. So what's the address of that one?
It's 350 Braun Road, B-R-A-U-N.
Okay. So why don't we just say that right now, Dave, why don't you go to 490, and Vern, you go to the 350 Braun Road.
Great. So Dave, you can look for Bonnie, or she'll be looking for you. And Vern, I'll be at the Braun Road location.
And also, can you make sure to have some of those brochures with you at the Braun Road location?
Yes.
The unit brochures. Great, thanks.
And I'll also give you.
That brings up,
Okay.
we were thinking, I know Bonnie, you and I talked about having some EOI forms printed out for the enrollers. And then before this call, I was just thinking maybe we should have some of those 401k forms. What do you think? I mean, we certainly have it in the system, but the enrollers won't have a printer with them.
Yep, so we can get the 401k form, and also because this is the first time we're offering domestic partner coverage, we'll have some of the affidavits available as well.
Okay. If you want to send that over to me too, I can just load it in the system, make sure we just have it there.
Yep.
Is that for the medical then?
That's for all of the plans, with the exception of Flex.
Okay.
It does not apply to the Flex plan. And Katie, can you just confirm that does it apply to Unum?
You do not need the affidavit for Unum as far as Unum is concerned, but if you want domestic partner applicability there, then yes, they can do that. We'll need to verify whether they set it up that way. It's a pretty easy flip of the switch if you want to include domestic partner. So we can shoot a note over to them right now and verify that.
And so then the pricing would be the same as spouse?
Yes.
Yes.
All right, so let's take a look at the system. You guys have the link. Deanna provided logins. You confirmed that you can log in, which is good. And of course, you're familiar with the program, but I'm going to take you through this one specifically. So when the employees, post-enrollment, when the employees have view-only access, they're logging in self-service. They don't see this first screen here, but all they have the ability to do is view their benefit options. They can change their beneficiary, change their address, change their phone number, but that's all that they can change. They do have these documents here, the forms library that contains all the documents we've been talking about. They do have that in their view as well. So I can go to enrollment and employees. I have a kind of a test person here already ready to go. Just use the search bar, use last name, first name, last four social to pull up the employee. Click on the employee to enroll. As enrollers, you don't really change any of this information, just hit on enroll. And then that comes to the welcome screen. If an employee were logging in self-service, this would be the first screen that they see. So we have a welcome introduction, little paragraph here. We have a list of benefits, and as I mentioned before, they're broken out. Many of them are broken out by employee, spouse, and children, so it looks like a lot, but it's not really. Just click on next. Personal information. So any required fields will be locked down here. You can't proceed without them. If the employee wants to update the information that's here, we would encourage them to do that because that gives good current information back to the group and to the carriers.
Yes, I'd like them to have the counselors verify that information with the employees just to make sure that I got everything in accurately. Thank you.
Will do. Dependents. So if to add a dependent, you just click on the plus sign here and then type in the information and hit save. But my test person has some dependents loaded.
We aren't seeing the dependent screen. We're just seeing the first screen with the employee information.
Interesting.
God, I can see the dependent screen.
Okay.
Now we can.
Okay.
Yeah, it must be just a lag in the webinar, I guess. I'll slow down. Okay, so medical plan options. So you have the names of the plans and then just a little description of which plan it is, the $500 deductible, $1,000 no deductible. This is a copay plan here. And you can see that the rate is more expensive, of course, because it's a very rich plan. So you just choose the tier. I have some dependents loaded, so I can do whatever I want here. So choose the tier and the plan that you want and hit enroll, or you have a big decline button there. One dental plan with in and out of network benefits, as we discovered here. You just choose the tier or decline. Vision plan, only one plan, same thing, either choose your tier or decline coverage. Healthcare flexible spending account. So this is works on a calculator, so I can put in, if I'm doing $50 per pay period now, I know that's what I want to do. I can hit calculate and it gives me the annual, or I can just put in the annual amount and it'll give me the per pay if I know I'm already doing $1,500, a year. Calculate gets me the per pay.
A change for this, in case employees ask the question. Currently, the flex plan has been deducted over the course of 26 pay periods. Starting with this new plan year, April 1st, it will be 24 pay periods.
Okay. Next plan is dependent care flexible spending for daycare, for example. A lot of employees that are using this probably will max it out, but of course the benefit is the tax savings. And this one is 26 deductions.
It should be 20.
It should be 24.
It should be 24. Deanna?
FSA?
Dependent care FSA.
The dependent care FSA?
Okay, gotcha. I think I updated FSA and maybe didn't do the dependent. I'll do that right now.
Thank you.
Done.
Okay, great. So the accident plan, what you're doing here is you're interfacing with plane.biz, which is Unum's tool. So it's kind of the system is going out, grabbing that, and bringing it in here to the interface. And you can choose your tier, or you can waive coverage. It gives you the cost per pay period based on whatever tier you choose. And
so for the group accident, that is 100% employer paid. So unless they don't meet the requirements, which is working 30 hours a week, then the no thanks should not be an option.
it's employer paid?
What?
The group AD&D is employer paid.
I think it's
Oh, no,
that's
this
different.
is the,
Yep.
yeah, this
You
is
about
the
gave me a heart
Unum
attack, Jamie.
Okay, so
This
group
is
accident
the
is
accident insurance. Yes.
okay. Sorry.
This is the Unum
Okay.
accident.
We're so generous.
I was like, why are we bothering enrolling this? We just need a census.
Yeah.
All right, good. Whew.
Okay, so you choose the tier, you select the beneficiary, but I don't think it's a requirement. And then you hit enroll. Takes you to the next program, critical illness, Unum critical illness. A couple benefit options here. 10,000, if I slide the bar over 20,000, you can see the rates are changing here. And then you choose your tier and enroll or waive. Beneficiary, it's going to load the dependents here. You can choose them easily, or you can click the plus sign here to add someone else.
So the benefits, so if we've added benefits to the health insurance plan, will the names actually propagate throughout the system to the other plans?
The dependent names?
Yeah, for example, if my husband's name is John, when I get to the beneficiary on the critical illness.
The beneficiaries do.
Yeah.
Beneficiaries, yeah.
Will it say John and Paige and Daniel, or will it say spouse and dependents?
No, it'll have their names. If they're loaded in as dependents into the system, then yes, it'll have their names.
Thank you.
Sure. This is spouse critical illness, so it's a separate policy. 2 options, 5 or 10,000. It's all guarantee issue. That's why it's green. You can see the rate changes there. Accept or decline. Beneficiary. Now this is a spouse policy, so it gives the employee as an option to be a beneficiary. Hospital indemnity. Who would you like to cover? Beneficiary, there is the rate. Just click on enroll. Says, are you sure you don't want to name a beneficiary for yourself? So you can add it. You can click here or click here to add the beneficiary. Or you can say, yes, I'm sure I don't want one. I think people should probably put one in.
What is the benefit to not putting one?
There's no benefit to not putting one in.
That would really only create confusion at claim time.
Yes.
Yeah, so let's not make it optional when we're talking to the employees.
Agree.
You got it.
And they'll have their beneficiary information. They're supposed to bring that for their life insurance that the company is paying for. So once that's in the system, it should be really easy for them just to keep picking as you're going through, I would think.
Right. Yes, exactly. So this is the company paid basic life, $50,000, no cost to the employee. But we need that beneficiary. They can choose a contingent, of course, as well. Basic short-term disability. So this is the one that is 50% paid for by the company. 0-day waiting period for a sickness, 7 days for an accident. And let's see here, up to $1,000 a week benefit. So for this person, it all breaks it down. It's 60% of salary. It tells you what your weekly benefit is and the cost. Most employers, by the way, don't contribute to that. Basic LTD, company paid benefit, 100% company paid. That's your monthly benefit. So short-term disability shows a weekly benefit. LTD shows a monthly benefit, 60% of salary, up to $6,000. 90-day elimination period to match up with the short-term disability benefit period. And then the benefit pays until Social Security retirement age. Most do. That was a question.
Yeah. Yes.
Okay.
For the until they're either no longer disabled or until Social Security retirement. Yep, makes sense.
Mm-hmm.
So not necessarily age, but if they end up getting Social Security disability at age 50, then their long-term disability would end. Yeah.
Sure. Okay, supplemental term life. So this person is a late entrant, or this person needs an EOI, let me put it that way. Everything is red, indicating that they need an EOI. As we talked about before, EOIs, paper EOIs will be on hand. So if this employee elects, $90,000 of coverage, you'll give them the EOI, tell them that they'll need to put in that $90,000 in the EOI, that's how much they're applying for, and fill it out. And those EOIs, did we cover this? The EOIs are going to be sent to the carrier directly or returned to HR?
I'm sorry, can you repeat that part?
Yes. So when the employee completes the evidence of insurability form, are they to send that directly to the carrier, or do they come back to you?
To HR.
To HR. Okay. Beneficiary. And then separately, accidental death and dismemberment. It's guarantee issue. You can see the maximum here, but you have a slider if they don't want to pay that much. Of course, I don't see why you wouldn't max it out. No EOI required. That's for the employee. And then we have spouse term life. Same thing. It's red, means you need an EOI, or they need an EOI. Pick your benefit amount or waive. Beneficiary, again, it puts the employee in here as an option, but it doesn't have to be. It could be someone else. I don't know why the employee would have someone else put in there, but you never know. Spouse AD&D. Very inexpensive. And then child, $1 for 10,000.
Just a quick interjection. This is Katie. I did get confirmation from Unum that they did extend eligibility to domestic partners, so we are all set there.
Okay.
Scott, I have a question. So when you, to go back to the voluntary life, in order to have the voluntary AD&D, you have to have the voluntary life. If you don't take if you don't take voluntary life, there's not an option for the voluntary AD&D.
Okay, that needs to be changed. That's no problem at all.
Okay. I was thinking it wasn't working quite that way, so thanks.
Okay. Yeah, that's an easy fix. Okay, so 401k, they can put in a specific amount that they want to contribute, or they can put in a percentage of salary. So it's pretty cut and dry. They want to put in $5,000 or 6% or whatever.
So then you, did you get, I resent the spreadsheet with those numbers in it for the 401k. Did you get that? Okay.
So yeah, I got the traditional one. Yeah, I got the traditional one reloaded, and I'm just, yeah, I had you on mute because I'm over here cussing Excel. So anyway, no, I didn't. But
sorry,
I'm trying to get the Roth ones up. It's not your fault. It's just something going on with my file, so I've just shut everything down. And but the Roth, I'll have it updated shortly.
Okay, thank you so much.
No problem, no problem. And I'll shoot you an email. I've got the rest of the. I don't know if you've noticed the verbiage on the screen. All those changes you sent. Thank you so much for that, Bonnie. They've been made except for this last Roth load.
Oh, okay. Great. Thank you.
There's the form. So guys, what we're talking about is the group gave us current benefits, including this one. So we know, you will know when you go in the system, you'll see the medical plan and tier and rate that the employee is currently getting or paying for everything, including their contribution, whether it's a flat amount or a percentage of salary here. And I'll show you that here in a second. I know we're almost out of time. Oops. Oh, is there a cap? I guess there's a cap. Beneficiary. So they have a traditional 401k and a Roth 401k or a Roth account. They can contribute to both if they want to. And I believe the difference is that the traditional 401k is a pre-tax contribution and the Roth is an after-tax. It says it right there. But they can still set additional funds aside. Beneficiary again.
I'm going to have to drop off here in a minute.
Yeah, I know you have a call in a minute here.
Yeah, this is Katie. I'm in the same boat. Teresa, can you stay on?
Okay, so here's a summary of all of their elections. It says right here at the top of the screen, if you want to make some changes, you can click on the little links here and go back to the product. When you do go back to the product, if they decided, I don't really want that vision plan, you have to click the unlock button, and then it'll let you back in. You can make the change then. So you have a summary, everything they elected or waived, a description, pre-tax, post-tax, employer paid, which is significant. Click next. And then we get to the page where we have a confirmation. This is a draft confirmation. It's draft, it's not signed yet. It's just a review, just like the previous page, but it's in a document format. That looks like a very high deduction amount. Why is that? Yeah, it looks like that 401k is coming out as a per pay period instead of an annual on here. I'll address that with Deanna. 401k. All right, that's an easy fix. You'll sign it with your password, guys, that you access the system with, just like I did here. Congratulations means that you're finished. And as you scroll down, you get a summary of everything that you've elected. Okay. When you hit return, it's going to kick you back out to the front. Well, it kicks me all the way out. I think that's right. Yes. And now when I go back in, it's if you don't time out, it'll push you back to this screen where it shows me that the employee I just enrolled is now completed. So I can go to the search bar, pull up the next employee. I'm actually going to pull someone up here because I want to show you current coverage. I'm just going to bring in a person here. So the coverage tab here, because you're going in administrative view, that's a kind of a quick summary snapshot that you can see what they're currently enrolled in. Okay. We have to get this fixed, but that's not the amount probably, but these other ones are the plans they're enrolled in. So that's a quick snapshot overview of what they're enrolled in. But when I go into their record to enroll them, I'm going to get past a screen or two here. Home phone and email are required. I'll reset this employee later, but if they don't have an email, no email. But you still have to put it in the email format or it'll kick it out. It'll reject it. Dependents, I'm just going to skip through this. Okay, so they didn't have the medical plan.
Scott, this is Vernon. On the dependents, are they preloaded with their social, or how do is it going to be worked the same way that they're going to have until the end of the month?
I don't believe we received dependents.
No, the dependents and beneficiaries were not supplied. We've been telling the employees that they need to bring their dependent and beneficiary information with dates of birth and social. So you should be asking for that information from them.
That's what I was wondering, if we had to, or if they have preloaded. And if they don't have it with them, I just go back in, log in, if they give it to me, or how do you want that? You know, they sit there and say, I don't have it, but I'll get it to you tomorrow. Just go back in, same as.
Yeah, there's no way of completing their enrollment if they want their dependents covered. So you're kind of dead in the water, and you'll just have to log out and enroll them later.
Okay. Well, I'm going to be there the whole week anyway, so I guess it really doesn't matter.
Right.
Will you at least be able to save what you've done so far, or will you have to start over?
It'll save anything you've entered up to that point.
Okay.
Yep.
I'm not much of a gambler, but I'd be willing to bet people are going to show up without their stuff. So as many times as we remind them, unfortunately, I think it's going to happen.
Right. So yeah, I just wanted to show you that when you go into an employee, if you click on that coverage tab, it shows you in a snapshot what they have today. So it just makes it easier. They can see it, they can remember what they have, because honestly, nobody knows what they have, unless you're in HR probably.
We have
so they can see a snapshot of what they have. What's that?
We have no record of what they had?
Yes, that's what I'm showing you here, is that the coverage tab shows you exactly what they have today. And then when you click enroll, you go into their record to choose what they're going to have going forward.
Got it.
So they just this one had basic life. They did have the short-term disability. They're paying 50% of it, as you can see here. They had long-term disability because this company paid, and they were contributing to the 401k. That's all this employee had. And you click enroll, and it puts you right into the benefits. And that's about it. I think we've covered everything. I will have Deanna look at that 401k calculation, obviously, to break it out per pay on the lump sum. And for the enrollment team, I'll send you the recording, post the call here for reference. And you can log in, you know where to go, you know who you're meeting with. And I'll update the training agenda actually with that address as I made those changes to the schedule. I'll send that to you as well. And of course, as usual, you have my cell phone number. Please call me at any time with any questions.
Can you also add when the counselors are talking to the employees to the Benaware system, the main reason that they're asking for that email address at the beginning is because they'll get emailed that benefit summary. So it's real important that we have an email.
Yes. The confirmation form, at the end there where we sign it with the password, that form will get emailed. It takes about 24 hours or so, but it gets emailed to the employee if they put an email address in. If they don't put one in, or you have to put in that noemail@noemail.com, they won't get that. But let them know that they will be receiving that. It's generated from the system. So, just tell them to keep an eye out for it. It's exactly as it is displayed on the page, but we don't want them to discard it, That's another thing, by the way, when they log in self-service after the enrollment's over, they can view their benefits, but they can also get, they have their own forms library. Let me move this thing out of the way. They have their own forms library, which contains their last confirmation form. It's always updated as they make changes. If they come back to you later, a new form is generated, a new form is emailed, a new form is loaded into the forms library for their use.
Scott, one quick change on your addresses. The Easton Alley address, There's 2 E's on East Denali. I don't know how familiar they are with the location. Okay, it was just cut off with that other view.
Yeah.
That's spelled correctly.
Yeah.
What I was seeing, it was just the extra E was cut off.
Okay. Got it. All right. Anything else from anyone? Any questions from the enrollment team while we've got the group here?
Scott, I got one question for you.
Sure.
On signing that application with the employee, we cannot use their last 4 of their social. It's got to be our password.
I don't know. Let me check on that. I don't know if we've PIN code enabled it. We probably have if there's going to be self-service access later. So if that is the case, it's the last 4 digits of the employee's social and the 2-digit birth year. So 55558 or whatever it is. Let me check on that. That'll be something I'll circle back with you on, if it's PIN code enabled or not. Good question. Jamie, Bonnie, anything to add?
Yeah, can we share mobile numbers in case someone's lost on Monday morning?
Sure. I'll send the enrollment team yours. If you'll send me, excuse me, I'll send you theirs. If you'll send me yours, I'll pass that over to them.
Great.
Good idea.
You'll need, so Bonnie's going to set up Wi-Fi passwords. Is there anything else that you'll need when you're on site?
For us, just the brochures, the EOIs, those affidavits, domestic partner affidavits, and then that 401k form. But otherwise, we need an electrical outlet to plug in a laptop, but that's about it.
Okay. And you're planning on how long for lunch?
I believe it's scheduled for an hour, I believe.
I believe it's an hour up here. It's an hour here and then
it's
a half
30
hour
minutes in Georgia.
in Georgia.
Yes, that's right. That's correct. Yeah. 30 minutes in Georgia.
Do we know the name of the counselors for the Georgia location?
It's Alina. She's on the call.
Hello, yes, I will be there.
And she's a veteran as well. One thing regarding, I was like, for my team, we'll reach out to you for hotels and what have you after this call. All right.
Okay. And we're clear that in Wisconsin, for the health insurance, it's the 3 HMO plans only, and in Georgia, it's the PPO plan only.
Gotcha.
And also, can you tell me if we're looking at one of the Georgia employees, as we go through the screens, can you confirm that they will not be able to even view the HMO information?
We can take a look at it, sure.
Thanks.
Let's see.
The second person on your screen is a Georgia location.
This one here?
Yep.
Great.
Yeah. Also, guys, for my team, see that little current flag there? It tells me that the employee is currently enrolled in medical. You can use the coverage tab. I like to use the coverage tab because it shows you everything in one shot, but you can do it this way too.
That's good.
Yeah. All right. Anything else from anyone? I've got a few follow-up things here.
Nope, I think I'm good.
Yeah, that's
I'm good.
I'm good.
Okay. Okay, great. Well, thank you all so much for joining. We're excited. It's been a process to get everything set up, but we have a very good cooperative group here that's been very instrumental in getting us the data that we need and helping set up the meetings and doing a lot of legwork. So we're very appreciative of that. And we look forward to a good enrollment next week. Thanks all for joining, and have a good afternoon.
You as well. Thank you.
Thank you.
Thanks, Scott.
Thank you, everyone.
All right. Bye-bye.